Hello everyone and welcome to another day of high yield USMLE questions. Today we are going to talk about neurology. So this is a 47th question in the medicalized question bank. So we have a 35-year-old female presented to the office with a headache. She has been getting the headaches for the past month and are not relieved with over-the-counter painkillers. There are no associated vomiting or visual changes. Her current medications include oral contraceptive pills, and she has recently used doxycycline for a tick infection. Usually for most of the tick infections, you give doxycycline. So that could be Lyme disease, could be a lot of other tick diseases. BMI is 34, which is obese. Vitally, the patient has a blood pressure of 140/70, heart rate of 80, temperature is 97, so that's fine. Slightly there is hypertension there. CT scan is done, which is normal. Which of the following is the next step in management? So now this patient has something called idiopathic intracranial hypertension. Idiopathic intracranial hypertension. Another name for this is pseudotumor cerebri. So this patient has no vomiting and no visual changes. Visual changes occur with idiopathic intracranial hypertension if it is very severe, when it is compressing the optic nerve. Here there are no visual changes, so probably it's not very severe, but it's still idiopathic intracranial hypertension. So these are the risk factors. Female toad is the mnemonic for this. Female toad. So F is for female, T is for tetracycline, O is for obesity, A is for female toad. So A is for vitamin A toxicity, like isotretinoin the patient may be using, and D is for danazol. This patient is using a tetracycline, which is the doxycycline. This patient is also female, and also the patient is obese. So these were the three risk factors in this patient that suggest that this patient has pseudotumor cerebri. Now, the next step in management is CT scan or brain imaging, could be MRI, which is already done, and usually it will be normal because you want to do CT or MRI to kind of rule out intracranial mass, and here intracranial mass is ruled out. So now, once you rule out the intracranial mass, you have to then confirm it, and the confirmatory is LP. So remember, lumbar puncture is a confirmatory, but you should not do it before doing any brain imaging. Like, you first do CT or MRI to rule out intracranial mass, and then you do a lumbar puncture. Because if you did lumbar puncture in this patient without first doing CT or MRI, there may be an intracranial mass, and you may cause herniation. So first do CT or MRI, rule out the intracranial mass, and then you are safe to do lumbar puncture. It is going to show increased opening pressure, usually greater than 250 opening pressure. That is diagnostic for diagnostic for your pseudotumor cerebri. And remember, lumbar puncture is both diagnostic and therapeutic. So once the diagnosis of the pseudotumor cerebri is made, the next step is giving them a drug, or also first recommend lifestyle modification, like tell them to lose weight, for example. Also avoid all of these risk factors. Then the next is the pharmacologic, which is, for example, acetazolamide, which inhibits, which is an inhibitor of carbonic anhydrase, and that will reduce the synthesis of CSF, and it will reduce the ICF. Topiramate is also used. For pseudotumor cerebri. Mannitol has no role in pseudotumor cerebri. It's more if you have very high intracranial pressure due to a mass lesion or edema. In those cases, you may use it, but here there is no role. MRI is not needed here because CT is already done. You just need one CT or an MRI, and if that is normal, you can progress. You can just go forward with the LP to diagnose it and then manage it. Now, I hope this video was helpful. If you like the video and you like the similar content, you can just subscribe to the channel, also like the channel. Also, you can go to the link in the description and support the channel if you want more of a similar content. Also, I have in the links my high yield step 2 CK notes, step 3 notes, and also I have immunology slides as well. So hope this video was helpful, and see you in the next one.